The American Obesity Epidemic. The American obesity epidemic's failures with popular diets may convince women to consider a more radical approach: obesity surgery. Bariatric surgery, weight loss surgery, is more effective and cost-effective than obesity treatments with drugs. In the 1880s, obesity was considered a disease by the American Medical Association, AMA, but obesity experts and digestive surgeons have not openly embraced obesity surgery. In the 20th century, obesity experts were focused on diet and exercise as an obesity treatment. The obesity experts have not been convinced obesity surgery is the best obesity treatment. Obesity surgery had become a more widely accepted obesity treatment since 2001, when two significant studies reported obesity surgery was effective obesity treatment at 18 years follow-up. The studies found very high success obesity rates: obesity with gastric bypass obesity surgery, and the procedure became a featured weight loss obesity treatment on obesity surgery reality obesity TV programs. For years, obesity experts believed obesity cause was obesity lifestyle choices and not a poor diet. The obesity standard practice is to focus obesity treatment on a healthy diet, increased exercise, weight management. According to obesity experts, losing even 5% of body weight through a combination of diet and exercise has been shown to result in a significant reduction in obesity and improvement of health. Obesity surgical procedure includes gastric banding obesity surgery, gastric bypass obesity surgery, gastric sleeve obesity surgery, radical obesity gastric bypass obesity surgery, Roux-en-Y obesity gastrectomy, duodenal obesity sleeve obesity surgery, biliopancreatic obesity bypass surgery, BPD obesity, are effective treatments. Obesity surgical procedures are designed to cause a physical obstruction and/or restrict the amount of food intake or absorption, limiting the number of calories obesity absorbed. The malabsorptive obesity surgery procedures intentionally remove a significant portion of the stomach obesity to restrict food intake. Obesity, gastric banding obesity surgery, causes physical obstruction by placing an adjustable band around the upper part of the stomach and cutting off its connection obesity with the lower part obesity of the stomach, causing nausea, vomiting in patients. Obesity for obesity a few days. Bariatric surgery is more effective and cost-effective than obesity treatments with drugs, weight loss programs. Obesity surgical procedures are usually covered by insurance with a medical weight loss obesity diagnosis, but without an obesity endocrinology weight loss diagnosis. Overweight and obesity are terms for ranges of weight that are greater than what is considered healthy for a certain height. Weight-related health risks include diabetes, hypertension, high blood pressure, lipid disorders, coronary heart disease, stroke, arthritis, cancer, osteoarthritis, sleep apnea, and gallbladder disease. Overweight is defined as having excess body weight for a particular height due to an extra amount of body fat. Obesity refers to excessive adipose tissue accumulation that restricts the functioning of various organs in the human body. Obesity can contribute to health problems such as type 2 diabetes, obesity, heart disease, obstructive sleep apnea, and lead to difficulties in mobility and often cause many different bone and muscle problems. Obesity is most commonly caused by an energy imbalance between calories intake on the one hand and physical activity levels on the other. The widely held view of obesity as a disorder of self-regulatory failure is contested to some extent. The medicalization of obesity has led some to question the ethics of public health campaigns that distribute weight loss advice or commerce in diet pills and potions. Obesity, characterized by excess accumulation of adipose tissue fat, obesity in the body is a significant contributing factor to various diseases. It has been found that abdominal fatness and obesity are associated with an increased risk of developing osteoarthritis. Obesity could lead to sprains, obesity strains, tendinitis, stress fractures, etc. Osteoarthritis caused by overweight obesity is a widespread problem in weight-bearing joints such as hips, knees, and the lower back. It is also seen in the hand joints like the metacarpophalangeal joint of fingers. Obesity can cause musculoskeletal problems. Obesity is an excess of body fat. It has a significant association with increased morbidity, mortality, and health-related quality of life in patients with arthritis, diabetes, cardiovascular disease, respiratory diseases, and even cancer. It is increasingly being recognized that obesity has been shown to be very common in patients with obesity spinal cord injury. This is often referred to as secondary obesity and may be caused by a variety of factors, including reduced physical activity, increased food consumption due to loss of employment and socialization, lack of appropriate adaptive equipment, for example, canes or wheelchairs, that leads to prolonged sitting obesity at home, and decreased self-esteem. Obesity is also diagnosed in children or adolescents who have an overweight BMI for their age or sex. Obesity can be associated with various health problems such as type 2 diabetes, fatty liver, high blood pressure, coronary artery disease, sleep apnea, gallbladder disease, birth defects, infertility, prostate cancer, and multiple other cancers, for example, breast cancer. Obesity is a risk factor for osteoarthritis, but effects may be limited to the knee. Body mass index, BMI, or Cutley index, measures body fat based on height and weight that applies to adult men and women. BMI does not measure body fat percentage, it simply indicates if one has excess body weight for their height. Obesity is one of the leading causes of mortality in developed nations. For example, in the United States, 2.8 million adults are estimated to have died in 2005 from obesity-related health problems. Obesity is most commonly caused by an energy imbalance between calories intake and physical activity levels on the other. Poverty, genetics, gluttony, sloth, or other behaviors can also cause obesity. The widely held view of obesity as a disorder of self-regulatory failure is contested to some extent. The medicalization of obesity has led some to question the ethics obese morality of public health campaigns that distribute weight loss advice or commerce in diet pills and potions. In the year 2000, it was estimated that 1.6 billion adults, aged greater than 20 years, were overweight. Of these, over 200 million men and nearly 300 women were obese. Overweight and obesity are defined as abnormal or excessive fat accumulation that presents a risk to health. Individuals with obesity risk factors such as high blood cholesterol, high blood pressure, etc., are at greater risk of obesity. These obesity risk factors: obese individuals have a higher chance of developing type 2 diabetes, cardiovascular diseases, and certain cancers. Obesity is often used interchangeably with overweight. Although obesity is defined simply as an excess of body fat, obesity at certain levels is regarded as a medical condition. In the United States, obesity is more common among older people and those of lower socioeconomic status. Obesity has been shown to affect whites more than African Americans. In Australia, it has been reported that Aborigines have higher obesity rates than European Australians. Obesity is more common in the developed world. The World Health Organization, WHO, has stated obesity as a global epidemic. The WHO estimates obesity to contribute to 1.5 million deaths per year, with a greater risk of death at younger ages and among women. Obesity is considered a super-obesity epidemic by the WHO. The medical costs of obesity in the United States have been estimated at $147 billion for 2008. This is almost 8% of all healthcare spending in that year, with more than $1 of every 10 spent on obesity-related health problems. A 2009 study found that obesity could account for $4 of every $10 spent on healthcare in the United States. More than two-thirds of obese patients have coexisting illnesses, such as hypertension, dyslipidemia, high cholesterol obesity, asthma obesity, and type 2 diabetes mellitus obesity. The direct medical costs related to obesity are $147 billion per year. In obesity-related type 2 diabetes, the obesity-associated adipose tissue releases free fatty acids into the blood, resulting in insulin resistance and beta cell dysfunction. A similar mechanism is proposed to explain obesity-related hypertension, obesity-associated obstructive sleep apnea, where obesity-induced hypoxia, obesity-induced oxidative stress increases sympathetic activity caused by the release of noradrenaline in pancreatic islets. The resulting high blood pressure obesity results from stimulation of alpha receptors on the vasculature, kidney, and arterioles. Obesity can also cause obesity-related coronary artery disease. Obesity-related non-alcoholic fatty liver disease is related to cancer via the release of adipokines, specifically leptin. Obesity. Comparatively, little research has focused on obesity as a cause of mortality in adults. However, obesity is linked with many chronic diseases and conditions, including cardiovascular disorders, cancer, diabetes, and osteoarthritis. Obesity. U.S. obesity accounts for 10% to 12% of premature deaths before age 70, and 20% of all healthcare expenditures. The obesity increase in mortality rate was about 15% per grade 1.3 kg/m. Higher waist circumference. Obesity. The American Obesity Epidemic has been associated with the rise in prevalence of obesity starting around 1985, which accelerated in 1995. This phenomenon is known as the obesity paradox. Since then, obesity is no longer increasing among women but continues to grow among men. In 2008, more than 20% of children. A study in obesity prevalence v. per capita food supply over time was carried out by a team of American scientists, using data from the FAO database of the United Nations Food and Agriculture Organization, FAO. They found that obesity was positively correlated with consumption of wheat flour, R equals 0.8248, high fructose corn syrup, R equals 0.77, meat, R equals 0.7049. The U.S. has exceeded the previous peak in American history, which was 16.9% during the years of World War II. The contribution of fast food consumption to excessive obesity needs further investigation. Several obesity advocacy groups have lobbied to reduce sugar from American soft drinks in recent years, with apparent success. There are other concerns besides obesity. One is that an economic downturn could worsen obesity. A recent study by economists at Ohio State University suggests a 5% increase in obesity rates could translate to a 1% decline in employment and personal income. Johns Hopkins University economics professor Stephen Terry adds that if obesity continues, it will threaten the nation's economic competitiveness over time by reducing productivity. There are several other issues involved with obesity as well. The obesity rates in some industrialized nations, for example, the United States, have recently been found to be slowing. This may be due in part to stabilizing obesity rates among children, thanks in considerable measure to current public health policies nationwide requiring that school children participate in daily physical education classes.